Share. Okay, can you see this?
Yes, we can.
Okay. This is kind of in our bailiwick of what we're talking about in our class, which is why I wrote this. So I want to talk about a dynamic population model. I know we're not biologists or people who study disease and biological mathematicians and all that, but the problem as it's set up uses the tools that we've developed in this class. I want to kind of explore this and show you things that you can solve using the tools that we have, and also to give you some insight. So we're going to talk about dynamic population models, and specifically we're going to look at this COVID-19 business that's everybody's talking about. So it's turned our world's upside down. Everything is telecommuting or from distance learning or whatever you want to call it. And I just found out today that all summer classes at A&M are going to be taught online as well. So it looks like this is going to be with us for a little bit. So we've been studying numerical methods, and this problem is a numerical method. And I thought maybe if I presented these models or a version of a model that's appropriate, it might provide you an alternative way of looking at this COVID pandemic from a different perspective, to give you a different way of looking at it, maybe to provide a little more insight and understanding. And this kind of stemmed about because last week and the week before, they kept talking about model predictions, and those model predictions were what the government officials were using to argue that they needed to do the things that they were doing. So I thought maybe if I could find a nice simple model for an epidemic in the literature, I could code it up and we could play with it, and maybe we could understand a little bit better why our government agencies are saying the things that they're saying. So that's kind of the motivation behind this. And I found a model published in Science, January of 2000. So it's long before our current position, but it was dealing with an epidemic, a disease epidemic, and they looked at several flu type scenarios in their paper. So I thought, well, let's see if we can apply their model to our situation and see what we can learn from it. So we're going to consider a population of size. So in this lecture, I'm going to choose the population to be Brazos Valley or Brazos County here, because that's where I live, and I can get the data from my local TV station and newspaper. So this is what we call a SEIR model, S-E-I-R. S stands for susceptible. Those are the number of persons who don't have the disease or who haven't had it yet, and therefore are susceptible to acquiring the virus. Then you have E, which denotes the exposed persons. Those are people who have been exposed to the virus by somebody who's infected. And then, of course, then you have the infected people, those people who currently have the virus and are suffering under its symptoms. And then you have those that have recovered, those people who no longer have the disease. They now have antibodies in their system to ward it off in the future. And it's also useful to bring in two other population groups, those that are born into the region. So we'll look at the number of births here in Brazos County, and those that die of natural causes other than, COVID-19 in this case. So my first disclaimer is I'm not an expert in this field. I'm a mechanics guy who likes to write software and does a lot of modeling. So that's kind of where we are at. So it took a little bit of interpreting and figuring out what they meant by, in particular, by events of death in their model. But this is what I ended up discerning what their equations were. So if you read their paper, they actually list the equations in a footnote. They're not written in the body of the text. Typical science paper, it's written for the layperson, not for the scientific. But we have basically four differential equations, four first-order differential equations. They're coupled. And so we have an evolution for the susceptible, an evolution for the those that are exposed, one for those that are currently infected, and another for those that have recovered. In normal population models, you would look at the terms on the right-hand side of these differential equations, how many ever you have, and you'd add them all up and they would go to zero. The sum would go to zero, which means that you are conserving your population. But this model doesn't conserve the population. It actually allows the population to change in size basically due to the number of births minus the number of deaths minus what we call, or what we denote as mu times I. Mu is what is often referred to as the morbidity of the disease. We'll be talking about that later. In other words, you can think of it as the percentage of those people that become infected that pass away. So what is that percentage? And that percentage is mu. So mu times the number of infected are going to pass away because of the disease, and therefore they are no longer counted in the population. So now if we look at the right-hand sides, the susceptible, all those that are born get add to the population of the susceptibles. So that's the first term. And then the second term has two contributions. One is the number of deaths divided by n times the, in this case, the population of the susceptibles. You'll notice that this term d divided by n appears in what we call the recovery term of all four of these equations. And the reason for that is if I were to add, when I add these equations, I have d to the n times s, d to the n times e, d to the n times I, d to the n times r. Well, s plus e plus I plus r is equal to n. So that when I add all these up, that sum on s, e, I, and r cancels with the n, and you're just left with d. That's how d comes about here. In other words, what we're assuming here is that the distribution of people who die of natural causes is uniformly distributed throughout these four groups. They're not all, say, susceptibles. They're not all exposed or infected or whatever. There's a fraction in all four populations. And then we have, in the susceptibles, we have this last term. And I'm going to forego discussing it in terms of susceptibles, and rather I'm going to talk about it in terms of those that get exposed. So what we have here is the fraction of infected. We have the fraction of infected, which is the total number of infected divided by the population, times this parameter beta. So beta represents the number of person-to-person contacts that take place between a typical person in the population for a given day. So this is basically beta times I on n is the number of interactions that take place with person-to-person interactions that take place with those that are infected. And then this gets multiplied. So that becomes then the fraction that's going to influence the susceptible. So we're going to take a susceptible person and basically infect them. So what we're doing here is exposing them. We're saying because we've had an interaction with a susceptible person with an infected person, that says now we've got a chance for somebody to be exposed. And then we're going to subtract away, again, the deaths that occur there. And then we're going to add a term here that is phi. This is the fraction of the exposed that become infected. So this appears as a positive here, or I mean as a negative here, and it appears as a positive here. You'll see this over and over again. So the number of, the change in the infected is some fraction of those that were exposed. In other words, not everybody that's exposed becomes infected, just some fraction, and that's what we're counting for here. So we have a plus this and a minus there. We have a plus here, and we have a minus of that same term here. This is common in all population models that go back to Locke and Volterra back in the late 1800s, where they were looking at predator-prey models. So we have what basically you can think of it, we're taking terms from the susceptibility and putting them into the exposed. And then we're taking terms from the exposed and putting them into the infected. And then we're going to take them from the infected and put them in the recovered. So the infected has, this is, again, the fraction of deaths caused by normal causes.
Could you try to assemble them into one big equation?
No. No. They're going to remain a system in this problem because
they're coupled?
They're so, yeah, they're strongly coupled. What the folks did on the prior page that I referenced is they put all these deaths into this, they distributed them. What I did that's a little different is I introduced the morbidity into the analysis. They assumed all their deaths were caused by that, but the morbidity just affects the, people who die are infected. If you're not infected, which is the case up here in these two, you're not infected. Down here, you've recovered, so you have an immunity. So your morbidity, the chance for you to pass away from the disease gets affected in here. So that's what mu is. And then you have, after you've been infected for so long, tau is the number of days it takes to typically recover from the infection. So if you're recovered here, then now that goes in as enters into a recovery term here. And then you have your removal of possible people who have recovered that otherwise die of natural causes. So this is the system of equations that is, in fact, the system proposed in the paper down here, published in Science about 20 years ago, with the exception that I specifically introduced a morbidity into the infected that wasn't in their paper. So this is the model now. So we have 4 variables, the S, E, I, and R, the susceptible population, the exposed, the infected and the recovered populations collectively. And then we have 6 model parameters. So then the question becomes, how do we deal, and what do these 6 model parameters represent? So we're going to consider a population. Like I said, I consider in this lecture Brazos Valley. Is it a reasonable population? Well, you choose the one you want. If you want, you can take this model and apply it to your local community where you're at today. But B is the number of births per day in your population. D is the number of deaths per day caused, not caused by the virus. Beta is a parameter that is the number of person-to-person contacts per person in the population per day. So that's that's a parameter. We're going to talk quite a bit about this because this is the parameter that the president, the governor, and your local mayors are all trying to manage with their ordinances that they're passing or their executive orders and the like. Phi is the fraction of the number of exposed that actually become infected per day. And mu is the fraction of the persons that succumb to the disease. And in the literature, or in the medical community, they would call this morbidity. And then tau is the average number of days needed to recover from the infection. And then again, we're assuming that the deaths distribute over these 4 populations. They don't belong to one or the other in particularly. We're just assuming that they all distribute according to their reflective numbers.
So essentially, this is just a crap ton of variables with a whole bunch of data.
It's trying to distill it down to the minimum number of variables that have some form of intuition or meaningful understanding. Many times when you're creating models, you introduce variables that aren't physical. They don't have an interpretation. This model is pretty simple, and the variables do have interpretations, but I can't quantify them all with the same accuracy. So we're going to talk about that. But down here at the bottom in blue, this model is by no means, it's a simple model. We're not talking about people migrating into or out of the population. You'll remember that our governor basically closed the border with Louisiana to basically mitigate this type of cross-pollination, if you would. There's nothing in the model that addresses quarantining of exposed or infected. So the model, if you implement measures, will change the future predictions, and none of that is implemented in the model. The model is designed to give just, if you basically left everything alone as it is on day 1, how will it advance through time? And the other thing that's not in here, that is in the model that is published in Science, is the influence that vaccinations have on the population. And the reason why it's not included in here is because we don't have a vaccination right now. So it doesn't make sense. So in many regards, this model is glorified simple. And you need to understand it and keep it in mind that it is simple, but it does capture the flavor of the event, and it does give insight into why our governors and president and mayors are doing the things that they're doing. So the next 2 slides basically talk about the four differential equations and put words around them. I've already done that. So you can go through those and look at them at your leisure, or if you're trying to figure something out. You can always ask me questions too. So now let's talk about parameterizing the model. And like I said, this is for Brazos County, and it's based on data that were available yesterday, April 2nd. So the births, I went to the Eagle, the local newspaper here in College Station, and I found an article that talked about the number of births that took place in Bryan and College Station. I didn't get the county, but I got Bryan and College Station. I figured if I get those two, I'm pretty close to the county. So that total number of births was divided for the year was divided by 365. When I did that, it turns out that there's 10 1/4 babies born in Brazos County every day. And that was the statistics for 2018. And then it turns out, based upon the numbers of people that live here, there are about 8.17 deaths per day. And this I wasn't able to find the actual number of deaths. What I did was I took a life expectancy of 76.1 years for the United States. And from that, in the population that we have here, I discerned that there's about a little over 8 people that pass away every day from natural causes. So I feel pretty good about these numbers. They may be a little different, but they're not going to differ by much. And they're not really big players in this. They're not really big players in this model either. They have an effect, but it's not major. Then there are a couple parameters that we don't know nearly as well as I know births and deaths for the county, but we know them. We do, there is kind of a sense of what's coming down based upon what I hear across the news feeds. And that is, roughly it takes 2 weeks for a person who gets infected to recover. So I took the time to recovery to be 14 days. And then there's this young fellow, I think in I don't remember where he lives. He's not in this country, but he's been collecting and publishing statistics around the world for all the different infected companies or countries, and has become the accepted statistical resource for COVID-19. And so based on yesterday's statistics, looking at the United States as a whole, morbidity is 2.3% per day. On any given day, those that are infected, it's an average of 2.3% that pass away countrywide. Now, if you look at the world statistic for morbidity is 4.3%, so it's almost double that of the United States. If you look at Italy, it's over 10%. So the United States' morbidity is actually quite low compared to the rest of the world. So those, the morbidity, those are based on statistics where numbers worldwide now are over 1 million. So the statistics part of it is starting to fall into play on that, and we're getting a pretty good handle. What I really have no idea on is what is the rate of transmission between those that are exposed to somebody who's infected and those of those exposures, what percentage actually become infected with the disease. So I guess 10%. You can change it, and I'll talk about that later on. at will. And that leaves one parameter, and this is the number of interactions between people in the population, an average number of interactions per day, whatever is considered an interaction. So, you know, the medical community is saying we need to socially distance at 6 feet. So if you're outside of 6 feet, then you're not basically, in my understanding of this model, you're not actually having a person-to-person interaction. Anyway, beta is the only parameter in this model that is allowed to be adjusted by behavior of the people in the population. And it's that parameter which our government officials are trying to affect by their statements or by their policies. So here are the initial conditions. These are differential equations. That means we have to have initial conditions for the differential equations. So these are the initial conditions that I used. The number of individuals living in Brazos County, I took from Wikipedia, which they gave as an estimated value for living in the county in 2018. And that's 226,000 plus. And then the number of exposures, I took this to be the number of people that were tested for COVID-19 by April 2nd in the county, which was 473. The number of people that were infected were the number of reported cases. So I have an initial condition of 68. Yesterday, there were 3 people who had passed away. Today, there are 4. 3 people have recovered. I haven't seen the recovered people of late. And we have picked up 1 more death today over yesterday. So we're at 5 who have passed away. So those are my initial conditions that I'm going to use in my analyses. Okay, here's kind of an interesting observation. As of yesterday, 48% of all infections in our county here are under the age of 40. And 69% of all infections came from communicable or within population transmissions. In other words, they got infected by not going to Cancun. They got infected because somebody living here was infected that infected them. So 70% of them have been able to be confirmed as being within the population infections. The thing that I found very interesting is almost half of the people that are infected belong to your generation. The other half kind of belong to my generation and the like. So that was interesting to me. I thought that was very high percentages for people living in their 20s and 30s in their teenage years. I guess the county reported its first 14-year-old that is infected today as well. So
Apparently we don't care that much about social distancing.
No, well, that's the challenge. Our kids, kids are very social animals and they want to play.
And younger people just think they're immortal.
It's tough. So that's
I can survive a fluid in my lungs.
Yeah, I'm not talking about how the actual process of death occurs in this lecture. I can talk about that because I've learned quite a bit about it. But anyway, we'll stick to the modeling side of our conversation, at least for now. I used the two-step predictor corrector method that we talked about in a prior lecture. to actually do the numerical integration. So that's available. But that's the one I chose to use. Now here's a set of 6 predictions that come out of the model. So in these, the susceptible population is in black, and it always comes up, it starts around 225, 226,000. And then it falls off very quickly. This is for beta equals 10. In other words, the average person in the population has 10 interactions with other persons in the population. So everybody's on average is in contact with 10 other people. And what you find in this is that the susceptible population falls off very quickly to effectively 0. So it doesn't take many days. So these are in days. So you're down to about 10 days from now. If we were working with a beta of 10, everybody in the county would be no longer susceptible. They would be exposed, or they would be infected, or they would be, some of them would be recovering. So the exposed is the cayenne color. You'll notice it kind of goes up very quick and then falls off. And the red are the number of people, the number of people that are infected on any given day. And the blue are those that have recovered from the infection. So that's beta equals 1, or beta equals 10. Beta equals 1, you'll notice that things shift to the right. The process slows down. And it slows down because now we have everybody in the population is roughly bumping into one other person in the population per day. So this slows down. So now the susceptible ones, it takes almost 40 days until everybody has in the population has interacted. And the exposed does not hit nearly the height or the peak that you have here. But the infected hasn't changed too much. The peak is still, well, over here it's probably about 80,000, and here it's probably about 70,000. So it's down a little bit, and it's also shifted to the right. You'll notice that the uptake is a lot faster than the downtake. And that's true of all of these types of equations, or this class of equations. So now we're going to go from having one interaction to having an interaction with another person every other day or every 4 days. And what you'll notice as the number of person-to-person interactions drops, the curves shift to the right, and the number of infected and the number of exposed diminish in there. These get to be a lot fatter distributions, but a lot smaller, a lot lower in number. So everything is moving to the right as beta gets smaller and smaller. And now we'll really get small. So every 5 days, we see now that the susceptibles are, at the end of 6 months, we still have 50,000 people that have not been exposed to the virus. We're still accumulating, and we have a peak of exposed and infected that's very small compared to the others. Remember, they were up here in this area. So now this is what the the president and the governor and the mayors and all these people, these doctors, when they get up and talk, they want to talk, they're talking about flattening and reducing the peak. Well, what they're talking about in flattening and reducing the peak is in the infections. So here the peak is high and it's not very flat, it's pointed. Here it's less high, but still pretty pointed. Here it's diminishing and it's diminishing until you're basically getting something that hardly looks like it's touching at all. So, you know, you're down to about 1 interaction a week here, which I was actually surprised it took this level of isolation to really minimize the effect. So it's very curious how this all works, and you're still having the infection. What you're doing is pushing it to the right, and you're diminishing its numbers. So I'll put up numbers in a little bit and explain how that works. So to actually, you know, from those curves, now the question is, how many people are actually infected and what would be the morbidity that you would predict from that? Well, how do you get that? So now what we're going to do is tell you, we solved the differential equations, but we have to process the data some more. We actually have to integrate the curve of the infected. So that's kind of what we're going to explain here, how I did that. So we begin by solving the Sears system of equations. In this case, we use the predictor-corrector method. And I integrated from 0 to 180 days. In other words, I want to see what this prediction will be roughly in 6 months from now, okay? If I wanted to see what it was going to be in 3 months, I'd integrate from 0 to 90 days. In a year, 0 to 365. So stopping where you integrate would tell you what your predictions would be at that point in the future. So what I'm doing is, after I integrate, I use the cubic spline that we created, and I fit that to the infected response, the I response. So I fit that data with my cubic spline, and then I use Romberg integration to integrate that spline from 0 to 180 days. Well, you would think that, okay, I do that, I get the infected, number of people infected. That's not what you get. It took me a bit to sort this out. What you're actually getting are the number of infected days of all the people in the community that are infected. So the typical person who's infected recovers in 14 days. So what I did was I took the number that I integrated by the Romberg, and I divided that by tau, which is the mean number of days needed to recover from the virus. So basically, every 14 days that comes from this integration basically means that one person has recovered, okay? So then when you do that, that gives you the number of infected from April 2nd to 180 days later. So to get the actual numbers, I have to add my initial condition in there. And now that I have my number of infected, I can multiply it by my morbidity rate, which is 2.4% for the United States. And from that, I can get a prediction on the number of deaths that one might expect to see if the disease is allowed to progress largely unchecked or unmitigated. So here are the numbers, and they're a little bit shocking. Now this assumes that there's a 10% transmission rate from exposed to infected. So it takes, for every 10 people that are exposed, one person becomes infected. And so beta, again, is the average number of person-to-person contacts made per day per person within the population. So what you see up here is 10, 1, a half, really these don't have a lot of change. In other words, we saturated. If we are cavalier and don't do much, it's going to cost roughly about 4,000 people's lives in the Brazos County.
Oh my gosh.
Look up to him. He's a really great guy.
Isn't
That's not Timothy, right? Okay. I didn't know if he was the old.
that blows you away, doesn't it? Now, you have to get down around one interaction per day or per week to get it down under 1,000 deaths, you know, and down to one interaction every week and a half gets you down to about 100 deaths. So you can't run away from it. So this parameter beta has a huge effect on the number of deaths that are predicted. Now, this is a model, first and foremost. It gives an answer. Is it accurate? I can't tell you exactly everything because I don't know some of the parameters in the model. In particular, the parameter that I don't know is phi. I don't know phi very well. I guessed it to be one person in 10 of those that are exposed become infected. Maybe it's not nearly that. Maybe it's more than that. I don't know. We don't have enough data yet to actually determine that. It's kind of, that will tell you what the shape of the curve is coming out of where we're kind of at right now. So if it's high, we're going to have a huge explosion in the number of people that contract this. If it's lower, we'll have a much less. But it has a huge impact. And beta is the only parameter that's actually in the population's control. Everything else is in the control of the disease. It's a consequence. We can't adjust it by behavior. We can hope for a vaccine, which would be wonderful. And I know there are great minds working on that 24 hours a day all around the world right now. So what we can do to help is try to minimize our person-to-person contacts outside of our family units. That will help slow down the progression and hopefully give our medical researchers chance to deal with it. So this is the kind of information that our federal, state, and local levels of government are using to justify what they're doing. This is why Governor Cuomo is in a state of panic.
Do you think, sorry.
Go ahead.
Do you think in your spare time, could you look at the past flu season and see how many people died from that? Because I've been hearing rumors of parent equivalent of a flu season.
The flu season, I think, is around 0.1% or less. So this is like an order of magnitude greater morbidity than the classical flu.
Oh.
For the flu season, though, wouldn't like the number of people possible to be infected be lower because of vaccines?
Yeah.
Yeah, the vaccine would skew it.
Vaccines affect it. And there's one of the reasons why this model needs to be kind of looked at in a serious way, or maybe not say this model, but better models that are hopefully being, used in like the National Institutes of Health and Center for Disease Control and things like that. Hopefully they got better epidemic models that account for more variables, but we don't have a vaccine. There's nothing that we can do medically to intervene in this process yet. So what we have to do is affect our social behavior, because that's the only thing that's available. We have to affect what amounts to beta in this really simple model. So the last kind of slide here, this is what I kind of learned from this exercise. Again, this is not my area of expertise. I just knew that you had differential equations that they were using, and I thought this would be an interesting problem to look at and maybe help my students, you folks, have a different way of looking at this and understanding the severity or the potential severity that you've got. Again, this is just a model. Is it an accurate or a good model? There's no way of knowing yet. I will say that this model was developed in 2000 and was applied to about a half a dozen different flu scenarios around the world. And they tended to look at flus like on islands and things like that, where you basically don't have people entering and leaving the population so that they can get a better look at it. But that's kind of all I can say. What I did learn is if you kind of leave things on its own, the epidemic is the outcome's not going to be changed very much. It may happen faster or it may come about slower, depending upon what the rate of transmission and what the rate of interactions are. But the thing is going to live through its cycle. Now, hopefully, like the flu bug, it basically disappears in summer. It has its own life cycle. And that's not part of any of this analysis either. This analysis assumes the life cycle. The disease doesn't have, the virus doesn't have a life cycle itself. The flu does. I mean, it goes away every year and then comes back. Anyway, so there's the thing that I kind of learned from this is it's really up to each person to try to do their best to adhere to the local government's guidelines, because the only thing that is in our control to try to help minimize this is our person-to-person interactions. And then if we can do what we can do, the further we can push the response curves to the right, the longer time we're giving our medical researchers a chance to secure a vaccine, and the longer it'll take before our health care providers become overwhelmed. So there are lots of interesting things here that basically lend support to what you're hearing over the news feeds, the expressed urgencies that the president, the governors, the mayors, et cetera, around the country and in their local and more regional jurisdictions. And so like I said, it's a model. It needs to be taken in that grain of salt, but I think it does provide a lot of insight that hopefully will help you kind of figure out and come to terms with all this. Maybe you can help your parents or your brothers and sisters and all that understand this as well. And my last slide is not one of the Hubble. It's me on a lake fishing up in Canada, thinking of carefree days in my past, and maybe hopefully you've got a good memory or three that you can think about too. So you have any questions?
Not really.
Was this useful?
I found it to be quite eye-opening. I
Yeah,
appreciate you putting it
pretty
all
nice.
together.
I actually looked upon this a little bit earlier in differential equations. We actually learned about this for about a week or two.
Oh, okay. So your differential equations class has been doing this?
Well, I took it about a semester and a half ago, but
Oh,
yeah, we were doing it. I'm pretty sure they're
yeah.
egging down on it or whatever.
There's what's called the predator prey model is a 2-parameter population model that is often studied. Um, it leads to orbits, solutions that are orbits. Um, you know, as the predators increase, the prey diminishes, and then as a result, the predators die off. Predators die off, then the prey their population grows, you know, and then there's more prey available, so the predator population grows. So it's kind of in this cyclic mode. But that was the original population model that was studied in the 1800s. And that's a classic problem to teach in differential equations. So I'm not surprised to hear that you've seen these kinds of equations.
They're useful. Actually, depending on your source, this goes to everyone, I guess. Be very careful on which sources you look at for the coronavirus and whatnot, because in many cases they will be skewed to various areas. Like for example, this one, I believe, if I remember right, was based off of College Station or the Brazos County. What do you say?
Mhm.
Uh, and then there was on the news where you had Nancy Pelosi pulled up a model that was skewed directly to New Jersey and New York, which are the most
Oh yeah,
compacted areas, so to
yeah.
speak, the
No,
ones that have the worst off.
yeah.
Yeah.
Every place has it. You know, you may have the same model, but they have different parameters and
Hmm.
different initial conditions and things like that. Um, so yeah, you're absolutely right. You know, you could look at the whole world. You know, but does that translate to what's happening in you know um, into the panhandle of Texas? No. You
No,
know, so
you,
it's, you know, that's true. You know, morbidities are vastly different across the world. You know, the morbidity in Italy is over 10%. The morbidity in Spain is 9%. Iran is about 4%. Um, I think China is around 4%. We're a little over
from what they
2.
say.
Yeah, from what they say. You know, there have been questions about their reporting accurately or not. But yeah, there's also the question of, you know, these are based on numbers of people that have tested positive for the disease. Morbidity may be actually quite a bit less than that, because people who don't get tested who actually have the disease, you know, because they have such a mild case, they don't get tested. You know, how big is that population? And nobody really knows yet. Um, so yeah, all this needs to be taken with a grain of salt, but it also points out a note of caution. Um, so it's unlike anything I've ever seen in my life. So anyway, I'm glad you enjoyed it. I'm going to stop sharing now.